Okay, welcome back to all of my dear viewers. Today I am going to discuss a very important topics for your university examination point of view. This is not related to the NEET page, but for university examination point of view, this is the most important topics. So we start the topics. Uh, According to the Park textbooks, there are seven uses of the epidemiology. One of the first use is the epidemiological study. It helps in to find the trend of a disease. Each disease is progressive in nature or a disease is declining in nature. The second use is that they help in community diagnosis, and the third is they help in evaluation and the planning. And the fourth is the evaluation of individual risks, and the fifth is the syndrome identification. Sixth is the completing the natural history of the disease, and the seventh is searching of cause and risk factor. Okay, so we try to understand this all uses, how this epidemiological parameter help in a study of all these seven things of the epidemiology. So we start the topic with how epidemiological parameters help in a study of the trend of disease. So for a study the trend of disease, we basically use two important epidemiological parameter. One is the incidence and another is the prevalence. So if incidence of any disease is more, if incidence of any disease is more, it indicates that in a population more number of cases are added. Also, if the prevalence of any disease is more, they also indicates that the more number of new cases added in a population, or the duration of illness is more. So this both prevalence and what incidence, they points to denotes that the diseases are progressive in nature, while the other hand, if the incidence and the prevalence of any disease is less, that indicates the declining phase. So we make a graph for a better understandings. At x-axis we take time, and the y-axis we take the prevalence. Okay, so if a disease is progressive in nature, if a disease is progressive in nature, so as the prevalence is increases, the progression of disease is also increases. While the other hand, if the prevalence is decreases, if the prevalence is decreases, the progression of disease is also decreases. So this indicates a positive in what progressive in nature. This graph indicates the progressive nature of a disease, and this graph indicates the declining nature of a disease. Okay, so so here we can see that how the prevalence and the incidence help in to find out the trend of this disease, either it is progressive in nature or declining in nature. Now we go for the our next use, that means what, community diagnosis. So how epidemiological parameter help in community diagnosis? Again, we can use the incidence and prevalence for the community diagnosis. For example, let's suppose malaria is a disease. If the incidence and the prevalence of the malaria is high, it indicates that in our community or in populations, most of the people is affected by the malaria. So if we having a knowledge that in our community most of the people is affected by that disease, so we first we diagnose the condition that in our community which disease is more common, or in our community most of the people is affected by which disease. So this one of the examples of a community diagnosis. So after the community diagnosis, we go for management parts. We send health worker in that area for the control of disease. We start the program for controlling the disease. So these all are examples which relate that how the epidemiological parameter help in the community diagnosis. The third thing is the planning and evaluation. So how the epidemiological parameter help in planning and evaluation? There are two important epidemiological parameter. One is the distribution and the another is determinants. So with the help of this distribution and the determinants epidemiological parameter, we plan we better plan and evaluate the disease condition. How what are the things include under the distribution condition? In distribution, the three things are includes: when the disease occur, where the disease occur, and whom are affected by the disease. While in determinants, they tells why the disease occur and how the disease occur. Okay, so let's suppose that we having a knowledge that when I mean let's suppose in winter season and in state Bihar and in female. So with the help of distribution, we having a knowledge that states Bihar in winter seasons, females are affected by any disease. Any disease, it may be any disease. So if we having a knowledge that in a state Bihar, the females are affected in winter season by any disease. So with the help of this knowledge, we send health worker, especially the female health workers, to that state for the management of the cases. And also we having a knowledge that why and how the disease occur. I mean, what are the pathogenesis of diseases and how this disease is spread. So according to this knowledge, how and why disease occur, let's suppose in the study it is found that disease is due to the low nutrients supply. So if we having knowledge that female is affected due to the low nutrient supply, so as a management we send lots of packets of food so we can treat those conditions. So with the help of this distribution and determinants, we having an idea about the disease condition, where the disease occur, whom are affected by the disease, and we go for the better management planning. So this all about the planning, evaluation. So how we evaluate the disease with the help of epidemiological parameter. So for the evaluation, what we do for the evaluation? For evaluation, we also go for the this distribution and determinants factor for the evaluation. How this distribution and determinants help in evaluation of the disease. Evaluation of disease means what we find what is the total number of cases in that area. So we prepared according its and starts the health program according this requirements. And also with the help of prevalence and incidence, we try to find the effectiveness of the programs. Is program is effective or not? For if the prevalence after starting the program, the prevalence and incidence both get decreases. That means the programs are effective. If they remain high, that means the programs are non-effective. So other fourth uses is the syndrome identification. In a population, we ask history about the symptoms of a disease. So with the help of collection of the sign and symptoms of disease, we try to find that the population is affected by which disease. For example, if in a population most of the people having the symptoms of Kaposi sarcoma, no, pneumocystis, and having a immunodeficient condition, so it points towards the HIV syndrome. Okay, so this is the four things. The five is completing the natural history of a disease. For this, we go for the cohort and case control study. So, with the help of cohort and case control study, we find the risk factor and what are the exposure of in this condition. The similar things is applicable for the searching for cause and risk factor. Here we also study for the cohorts and case control study. So with the help of all these things, they in all these things epidemiological parameter are very useful. So it's fine. Okay, bye.